Good morning, and thank you for joining us for this edition of SBB Live. I am your host and the publisher of Seniors Blue Book. Really excited today to bring on Dr. Hodge, who's joining us from FYZICAL, spelled uniquely, but everyone knows who you are by now. You've got a name for yourself. How are you this morning?
I'm doing well. Thank you for the introduction. I'm happy to be here.
Absolutely. Well, we're going to jump right in. First, I want to hear a little bit about you and your background, what got you into physical therapy, and then I'm going to ask you a few questions. So just talk to me a little bit about yourself.
Okay, great. So my name's Lydia. I'm a graduate from Gannon University up in Erie, Pennsylvania. Um, I got into physical therapy because I was mostly interested in just the holistic approach that physical therapy has and looking at the entire picture of the person and getting them back to their functional level. And I kind of got geared towards the pelvic floor therapy because that's just a topic that not everyone wants to talk about, but I love being that person that people can openly go to and discuss their problems. So it's kind of what got
And
me here.
yeah, and you know what I love about doing these education pieces is a lot of people, there's so many things that people need to talk about that they don't want to talk about or that just seems like an unattractive topic, if you will. So tell me a little bit about pelvic floor therapy. What are some of the symptoms, signs and symptoms, and what can you do about it?
So, pelvic floor therapy and pelvic floor dysfunction is actually very common. About 1/3 of women in the United States experience pelvic floor dysfunction. And this can be anywhere from urinary leakage to pelvic pain, and it can also be in forms of constipation or fecal incontinence as well. And this can be also based off of different things going on with the body, such as endometriosis. There's interstitial cystitis, plenty of things that can be causing pain or discomfort in the pelvic area. So pelvic floor therapy takes an approach that kind of looks at the whole picture. We look at what's going on with the body, and we also look at what's going on specifically in that pelvic floor area in order to kind of see what's going on to develop a plan of care in order to restore some of those issues.
Yeah, and that'll lead me to my next question. What are some of the treatment options that are available, and how effective are these treatment options?
So there's different treatment options. Specifically, in my field, we look at, we go through the examination and we see what needs to be done, whether it's strengthening of the pelvic floor or coordination, or sometimes relaxation can be very beneficial for people with pelvic pain. So we look at the pelvic floor's ability to do some of those things, and we're able to kind of give feedback in order to help the patient perform those exercises correctly in order to help what's going on with them. And it is absolutely effective. I've had patients who come in saying that they've been wearing pads for 20 years and never realized that they could do anything about it. And we have had patients see success with urinary incontinence within weeks. And that doesn't go to, that doesn't even cover all the other things that we look at. That's just an example, but it is very effective. And I encourage everyone who is experiencing any of these issues to see their local pelvic floor therapist.
Yeah, speaking of local, tell us where you are. Tell us a little bit about your office and how long that you've been there.
So I am located in Port Charlotte, Florida. I've been here coming up on a year. So I really like it so far, and we're really growing our pelvic floor program here at Port Charlotte.
Yes, that's fantastic. Well, thank you so much for coming on the show this morning and spending some time with me. Can't wait to get the word out. There's so many locations throughout Southwest Florida. But if you want to meet up with Lydia, you got to look for her in Port Charlotte.
Absolutely. Thank you so much for having me. It's very nice
Have a
to
good
meet
day.
you. You too.